Okay, thank you, Al. Okay, we're talking positivity rates here, and it's climbing to the highest it's been since June. So some are worried Ontario is approaching a fourth wave. And this morning, we welcome Dr. Andrew Boozary with the University Health Network to talk a little bit about what medical experts are seeing. Good morning, Dr. Boozary. Thanks so much for joining us.
Hi, good morning, Faiza.
Let me ask you first. So the last 4 days, the cases have been over 300. Is this cause for concern? As a doctor, are you concerned about that?
Yeah, I mean, it's definitely cause for concern. I mean, when we're looking at the issue of where the trends have been and are going, and sort of the last few days now, over 300 cases, there's definitely cause for concern. There's been a lot of talk and a lot of modeling suggesting, this could be the start of the fourth wave. It's looking like that in terms of the cases, but we want to still see more data, be able to better understand what is happening, what is taking place with respect to the cases, and hopefully seeing a decoupling from any hospitalizations or deaths. And that's something where, again, there's definitely a lot of concern. There's also a lot of reason for the encouragement about where Ontario and Canada stand in terms of the vaccine rollout. But what I think the cases are indicating is that, vaccines alone are maybe not going to get us to where we need to be. And we need to be thinking about, seeing higher vaccine uptake as well as other measures come into place as well.
Okay, Dr. Boozary has actually been on the ground doing a lot of amazing work in communities, trying to get people vaccinated. So you're quite embedded in many communities here in Toronto. So let's talk a little bit about vaccination rates here. Even as cases rise, are less people being admitted to hospitals, would you say, because they've been vaccinated?
Hi, Faiza. I cannot hear you at all. So my apologies. There was no audio in terms of the question.
Okay. Are you able to hear me now? Okay, I was just talking about all the wonderful work you've been doing in the community with vaccinations, encouraging more people to get vaccinated. When it comes to vaccinations, as the cases rise, are less people being admitted to hospital because they've got their vaccines?
Yeah, definitely. I think what we're seeing is that the vaccine is working. I mean, it was great to not hear your nice words. I mean, this is really a community triumph of community leaders and ambassadors really pushing door to door, and the groundwork over many, many months. That is where, the success has come from. And what we're seeing from real world data, from a lot of the new trials that are coming out, is that the vaccine is working. It's significantly decreasing the chance of cases, significantly decreasing even more effectively hospitalizations or deaths. And that's what we're seeing play out in terms of other jurisdictions, especially when you look at the US. What we're seeing is a real correlation is, again, with states that have low vaccination rates and now having higher hospitalization and death rates in some cases than any time throughout the pandemic. And where we're seeing more vaccine uptake, where people are getting that protection. There are, of course, cases of where there's what's been called breakthrough, but these are much less severe. We're not seeing hospitalizations, and we're not seeing deaths. So all of the international data, the data that we're seeing here in Ontario, really seems to suggest that people who continue to be unvaccinated or partially vaccinated are at much greater risk. And we're seeing, again, the success of the vaccine rollout in different pockets that early on were not getting supply. And this starting to see a lot of efforts and a lot of success on the ground because of community leadership.
Okay, Dr. Andrew Boozary doing a lot of amazing work in the community here in Toronto. Thank you so much for joining us today. Awesome. Time now, 7:16 a.m. Let's head upstairs to Stephanie Henry. Good morning, Steph.